This Africa Center for Disease Control and Prevention HQ was established 2 years back, aimed at providing disease early warning and response surveillance systems, respond to emergencies and more. So far, the center has registered a story of success.
The African CDC is an indication that Africa is now ready to, in Kwame Nkrumah's words, to fight its own battles and to take account of its own destiny.
The Africa Center for Disease Control has been awarded hands from China and the United States since its establishment. Beijing has even agreed to build an $80 million headquarters for it.
China CDC, for instance, has seconded 2 staff, who are currently working with us. Same for US CDC. So we have, the technical experts that are embedded within the Africa CDC and working with us in daily basis, toward the establishment and the achievement of the goals of the Africa Centers for Disease Control. China also provided, financial support. So it was a support that we really appreciated from our partners.
The African Union is now seeking more support from particularly its members to strengthen Africa Center for Disease Control. AU Commission Chair Musa Faki Mohammed recently said more sustainable support among member states is critical for sustainable growth and expansion of Africa CDC. Deputy Chairperson Kwasi Kwate reiterates that call.
We call upon our brothers and sisters from Africa to support the CDC as much as we have the assistance of the United States, China, and the rest of it. The CDC, after all, is Africa's response and also Africa's way of anticipating and strengthening the health infrastructure, both physical, intellectual, and human resource, so that Africans can take care of their health and prevent such easily preventable diseases from becoming a tragedy.
So far, the Africa CDC has proven itself instrumental by giving successful and catastrophe-preventing response to Lassa fever in Nigeria, Ebola in DR Congo, plague in Madagascar, and more. But the AU now wants this center to live up to its dreams, standing vanguard to Africa's health emergency response through uninterrupted continental support to the institution. And it expects a response sooner than later. Girum Chala, CGTN, Addis Ababa, Ethiopia.